Acne and acne scarring. This can be a lifelong concern, but sometimes can get worse or better throughout periods of your life. I would define the treatment of when you have the acne, the active acne, and then maybe for when the acne isn't quite as severe or active, the scarring and the hyperpigmentation changes which can be left afterwards. Different treatments for both. For active acne, we would generally start talking about skincare. That's always one option to start with, whether it be a cleansiderm system from Obagi, which is very much salicylic acid based to calm the area but also clear those pores, or other options for personal tailored home skincare. For active acne and also the acne scarring, a chemical peel is a really good option for you. A little bit of downtime, depending on the peel. Sometimes they don't peel at all, but sometimes you will get a bit of peeling and a bit of shedding of that top layer of skin on day about 3 or 4. So it might have a little bit of downtime. But what that can do is that can do a bit of everything. That helps clear the acne, reduce that redness and inflammation, can help with the textural changes of acne scarring, and also can help with their areas of hyperpigmentation that's left after the acne scarring is calming down. So that's a nice all-round treatment for acne and the scarring afterwards. For acne scarring, we might suggest microneedling, whether that's with radiofrequency or normal microneedling. Both do slightly different things. Especially if you've got some deep set-in acne scars, radiofrequency microneedling can be really useful. This is microneedling, so micro needles create micro traumas, and that trauma stimulates your skin to heal itself and heal itself better. When that is combined with radiofrequency, the radiofrequency heats the end of the needles, and by heating the end of the needle underneath the top layer of skin, it can stimulate collagen and elastin production, but also specifically for acne scarring, used in the right way, can really target those textural changes, smooth that out, and also help those areas of pigmentation by regenerating that area. Sometimes if you've got really deep scars, a personalised approach might be some subcision with local anaesthetic and needles in clinic, and sometimes you can even put in a little bit of dermal filler under the deepest scars just to artificially pop those little divots out. Very much depends on how your skin is, and a good consultation is always important to begin with. In other treatments in clinic, we might offer regular hydrofacials, so they're an amazing idea if you don't want injectables but you just want to feel good, but also they can really focus on deeply cleansing those pores, deeply cleansing the skin, and also reducing that inflammation load with regular skincare tailored around it. And LED light therapy. So LED light therapy works in 2 ways. By using red and infrared, it is reducing inflammation, reducing irritation and stimulating healing after a breakout. But using blue spectrum and ultraviolet spectrum can also help reduce the bacterial load that you'll have on your skin, and therefore reduce any active breakouts that way. Always happy to answer any questions. Thanks guys.